While Alabama may not be the least vaccinated state anymore, the vaccination rate is still too low here. Many people look to treatments instead of vaccination. Our Nixon Norman joins us live in the studio. Nixon, local officials still stress vaccination is the only way to go, right?
Julia, yes, they do, and many people are still turning towards treatments such as monoclonal antibody treatments, and in some cases having to be put on a ventilator. Local officials say it's better to prevent this illness now than to treat it later on.
In the age of modern medicine, most things can be treated, but that doesn't mean we don't get vaccinated against certain illnesses. The same goes for COVID-19. Health experts would rather people prevent themselves from getting the virus rather than relying on treatment options later.
You know, we don't need to take it to that point. We need to stop it before we get there.
One of the most popular COVID treatments is monoclonal antibody treatments. In some cases, people are hesitant to get vaccinated. They get the virus and then they require these treatments. But
both of these are mechanisms to get antibodies.
Smith says the vaccine and these antibody treatments are not much different. So if you think you are skipping out on what is in the vaccine by getting treated, that's not the case.
People will say, well, you know, that vaccine is under emergency use authorization. Let me tell you something, folks. So is that monoclonal antibody.
Another form of treatment against COVID, a last resort treatment against COVID, is being put on a ventilator.
We have 16 in the ICU, and all 16 are vented, and none of them have been vaccinated. And the average age is 56.
Powers says they try their best to keep people off of ventilators.
With COVID, we try everything we can to keep you from getting on the ventilator. So once that's our last resort, because the chances of you coming off of it are low.
Both health professionals say that getting vaccinated can decrease your chances of needing either of these treatment options.